Thank you, Tom, and good afternoon. Before I begin my COVID-19 update, I'd like to acknowledge National Accessibility Week, which calls on all of us to recognize people of all abilities in Alberta and work towards a more inclusive society. I want to thank the many individuals living with disabilities, their caregivers and service providers who have reached out to provide feedback and ideas on how we can make COVID-19 information more accessible for all people, and also to consider how these individuals may experience unique challenges and barriers in COVID-19 prevention, diagnosis, or treatment. Today, I am pleased to report that 6,587 Albertans have recovered from COVID-19, leaving 344 active cases in the province. Currently, 48 people are hospitalized, with 6 of these in ICUs. In the last 24 hours, out of 4,997 new tests, there were 19 new cases. Sadly, I must also report 2 new deaths. I wish to extend my condolences to the friends and families of these individuals, as well as to all Albertans who have lost loved ones during this time. We are now in our 4th month of pandemic response, and we continue to take steps as a province, as communities, and as individuals to prevent the spread of infection. I've read and listened to stories of how individuals and communities, big and small, across Alberta have worked together to respond to this pandemic. I am continually inspired by the ingenuity and generosity of our communities. This includes Indigenous communities across the province who have shared their stories with me. I want to express my gratitude and admiration for all the ways that they are keeping their members safe. Today, I'd like to recognize just a few of the many specific examples of actions taken by Indigenous groups across the province who have acted quickly to protect their community members. The Métis Settlements General Council has made emergency funding available to settlements for local emergency plan implementation, and their health board has had weekly meetings with Alberta Health Services to bring about some much-needed health and safety services, such as remote access to doctors, local testing, and access to personal protective equipment in the community. The Métis Nation of Alberta pandemic supports have included financial assistance for those facing economic hardship due to COVID-19 and the development of Métis-specific public health communications. The MNA has also helped transition cultural celebrations, such as the annual Métis Fest, to online platforms. This recognizes that Métis community, culture, and kinship ties are key to sustaining the strength and resiliency of Métis Albertans during this difficult time. The Aboriginal Friendship Centre of Calgary assembled an Indigenous COVID-19 task force to ensure their most at-risk community members have access to basic necessities to carry them through and to provide much-needed wraparound supports and services. This includes delivering food and non-food hampers and providing social services, virtual cultural supports, and mental health supports to Aboriginal peoples in Calgary. In the Saddle Lake Cree Nation, located on Treaty 6 territory, they worked hard on COVID-19 testing, making sure it was easily accessible for community members. Chippewan Prairie First Nation on Treaty 8 territory also made testing a priority after confirming their first case. Both these nations established drive-through services and worked with their health centers to help test community members. This easy local access to testing has helped make testing available to all in Chippewan Prairie and has ruled out COVID-19 in all those who have been symptomatic in Saddle Lake. Stoney Nakoda on Treaty 7 territory helped support their members by proactively creating a dedicated space for those who needed to isolate but were unable to do so at home. Their isolation facility supports up to 150 individuals, and nurses and other health providers are on hand to help support anyone isolating. While this facility has not yet been needed, it stands ready to make sure that safe isolation is supported for anyone who should be ill. Finally, the Alexis Nakota Sioux First Nation on Treaty 6 territory has started a national social media campaign called #ProtectOurElders. The campaign encourages Indigenous youth living in Canada to be partners in protecting elders from exposure to COVID-19. For more about the campaign, visit protectourElders.ca. I want to congratulate all those involved in these efforts for their locally driven work to support those in their communities. And I also want to honor the ways that their community members are supporting each other through this difficult time. These are only a few snapshots of great work being done across the province. So I also want to commend all the other work being done by First Nations, Métis, and Inuit communities and Indigenous serving organizations across the province to protect their communities from the spread of infection. There are many aspects to preventing the spread of COVID-19. We continue to study the virus and learn about how it affects people and to develop new ways of testing. One subject I receive many questions about is serological or antibody testing. This form of testing is used to detect the presence of antibodies in a person's blood. A positive test means that someone contracted COVID-19 at a point in the past, even if they have now recovered. Not all antibodies protect from reinfection, and antibody levels can drop over time. Because of this, there is still not enough evidence to conclusively determine if a person who previously contracted COVID-19 would subsequently be immune. This is a key research question for scientists around the world. Until we have this evidence, it is not possible to determine who is immune or for how long. Alberta's provincial laboratory is in the final stages of validating a number of different types of serology tests. Initially, when it's available, this testing will be used for research purposes to determine the proportion of Albertans who have been exposed to COVID-19. Please be very cautious of products marketed as home serology tests. These tests may not be accurate and could produce false results, either false positives or false negatives. We will share more information on serology tests in Alberta when it is available. It's important to remember that serology tests are not used to diagnose an active infection, but rather a past infection. As we still have active cases in our communities, our focus remains on diagnosing these active infections and preventing the spread. The test that's used for this is a molecular test, which is done with a nose or throat swab. I want to remind all Albertans that this molecular testing is now available to everyone, whether or not you have symptoms. Booking a test can easily be done online at the AHS website for a location and time of your choosing. If you have a disability that might make it difficult for testing, please call 811 to find out next steps. I encourage all Albertans to participate in our population-based testing to help us better understand where we have active cases across the province. We are still learning about the virus, but some things remain clear. Our best tools of defense right now remain staying home when feeling sick, maintaining physical distance when we go out, and wearing a mask in crowded spaces, frequently washing our hands, and making sure that we support each other in taking these steps. These practices are part of our new normal and will remain in a part of our daily routines for the foreseeable future. Albertans have done and continue to do a tremendous job of taking these steps wherever possible. That hard work has brought us to this point where the total number of active cases continues to decline and the increase in new cases is manageable. We will continue to rely on our collective commitment to protect our family members, neighbors, and friends, to ensure we keep moving forward toward the next stage of relaunch. Thank you, and I'll be happy to take questions.
All right, we'll go to the phone now. Operator, could you patch through the first question, please?
First is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. How much interest has there been now that testing has been expanded to every Albertan, whether they have symptoms or not? How many tests have been done for those who are asymptomatic? And are there any initial findings, hotspots, or patterns that have been detected?
So what we've requested from Alberta Health Services is a weekly report on asymptomatic testing, so that information will be available early next week. What we can see is there has been a slow, steady rise of the total number of tests being done, which is an indication of the uptake of testing. So, for example, today we came close to 5,000 tests processed in the last 24 hours, and yet have only 19 new cases. So this is helping us, again, confirm what we understand to be true, that, again, the majority of the province has very few active cases, and really encourage all Albertans to participate in this active population testing, whether or not they have symptoms, to help us get further confirmation of that.
Operator, can you put through the next caller, please?
Next is Shannon Scott with CBC. Go ahead, Shannon.
Hi, Dr. Hinshaw. Thank you for taking my question. Premier Kenney has tweeted that we may be moving into stage 2 sooner than expected. Is that something that you have recommended to the Cabinet Committee? And what would prompt you to recommend an early move to stage 2?
So with the fact that we saw much lower numbers after stage 1 relaunch than could have been the case, that was very encouraging, that we saw, even with many more businesses open, restaurants, retail, daycares, hairstylists, even with that increased activity, we were still able collectively to maintain a low rate and, in fact, have a decreased number of new infections. So with those really encouraging numbers, my team and I did take forward some considerations for perhaps moving the stage 2 of relaunch a little bit earlier, but again, there's still some final discussions taking place. And so a final announcement would be expected early next week on a final decision about that.
Operator, can you put through the next caller, please?
Next is Harrison O'Nines with the Eagle 100.9. Go ahead, Harrison.
Hello, Dr. Hinshaw. I have a question regarding private outdoor recreational facilities. We've heard from some business owners of facilities such as Granary Road or Caven Farms here in the foothills, or the Calgary Corn Maze. They're lumped in as outdoor recreational facilities, but they're unsure of when they'll be able to reopen, and there's a feeling that they've been lumped in with things like amusement parks and outdoor pools, wherein a lot of these places function similar to farmers markets. And I've also heard from some of these business owners that they've had trouble with BizConnect and getting answers on when they'll be able to reopen, as it seems a little foggy in the relaunch strategy. So really, what avenue can these business owners take, and is there room for some of these businesses to be reclassified given how they operate?
So we've heard a lot of feedback from recreation, fitness, and sports with respect to the original classification in the 3 stages of relaunch. So we have been looking at the possibility of moving that particular group, with certain restrictions and limitations, of course, as with all places that are currently open, into stage 2. And again, that's something under discussion. And I would anticipate that a final decision will be able to be communicated early next week. But I can let people know that it is being discussed. I think that it was really important that people understand that we are getting thousands of questions into BizConnect. We have increased the volume of people who are answering those questions, but I know it can take time, and so really appreciate the patience that people are showing, and recognize that it's hard to wait, especially when someone's livelihood really depends on an answer and they want to be able to plan. So we are working as quickly as we can to answer all of those questions coming into BizConnect. And as I say, you can anticipate that there will be more specific information available with respect to stage 2 by early next week.
Operator, can you put through the next caller, please?
Next is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. When will loved ones be able to visit family members in hospital again?
So I think that question is part of also the question about loved ones visiting family members in continuing care facilities. And those 2 visitor policies are tied together with respect to what we all want. We all want to protect those in hospital and to protect those in continuing care from risk of infection. And we all want to be able to support people in their health, not just their physical health, but their mental and emotional health as well, which obviously being close to loved ones is an important part of that. So that is something that is under active discussion, and we are trying to hold those 2 things in balance. We don't want to expose people to unnecessary risk. We also recognize that it is a hardship to be separated from loved ones, especially for long periods of time. And so I know that people will wish to have an answer sooner, but all I can say at this point in time is that we are under discussion, And so hopefully we'll be able to give some more information about that in the coming weeks.
Operator, can you put through the next question, please?
Next is Michael King with Global News. Go ahead, Michael.
Hi there, Dr. Hinshaw. Wondering why there is a delay in serology testing. It is something that we kind of heard probably more than a month ago. And is that something that can kind of be sped up with any help from the province?
So it took a while for the lab to work through. There were multiple different types of serology tests that were available, and the lab in Alberta was working with labs across the country, including the National Microbiology Lab, to test and validate each one of those different types of serology tests. One of the things that's really important is that when we do start using a serology test, that we can be confident about how it performs, and different tests perform differently. So taking that extra validation step was important so that we can be confident of the performance of a test when we do start using it. Once that validation step was complete, we now need to work on procurement of the test kits. And as you can imagine, across the world, there's quite a high demand for the test kits. And so that's something that's underway right now, is working on the test kit availability. And we're also working on setting up the frame for being able to sample. We're working with other partners across the country on national serology testing frameworks so that we can compare results. Because, of course, if we have a very different methodology in one province or another, it may be challenging to compare the results that we get. So some of those things take a little bit of time so that when we do start testing, we get the best possible return on investment by having consistency across the country, as well as using tests that are validated and perform well.
Operator, can you put through the next question, please?
Next is Matt Woodman from CTV. Go ahead, Matt. Matt, your line is open. Please check if your phone is muted.
Hello. Hi, Dr. Hinshaw. Sorry about that. The Premier also said today that aside from moving Stage 2 up, he also mentioned adding some elements from Stage 3 into that early launch of Stage 2. I was hoping you could discuss which elements of Stage 3 could be considered being bumped up into Stage 2, if you've gotten to that point yet.
So again, those things are under discussion, and final decisions we expect those could be communicated early next week. So again, while there's no final decisions, I have said on previous occasions that based on feedback we've received and some of the industry protective plans that we've received, we are looking at fitness, recreation, and sports as possible components of those potentially to be moved up. But again, final decisions would expect that those could be communicated by early next week.
All right, I see we've got just one more in the queue. Operator, could you put through the final question, please?
Final question is Jennifer Lee with CBC News. Go ahead, Jennifer.
Hi, Dr. Hinshaw. I'm wondering about the number of cases out there with no known exposure. So what can you tell us about sort of the current levels of those cases, perhaps how that's changed, and what does that tell us about what's happening out there in the community with transmission and the level of risk in terms of moving ahead into Stage 2 of relaunch, perhaps earlier than originally anticipated?
So I don't have in front of me the number of currently active cases who had an unknown exposure. What we know of all of the cases that have been reported to date, so of the 7,076 cases, that 671 of those were unknown exposure. But that doesn't necessarily tell us much about what's happening most recently. We did look at the cases with unknown exposure specifically in Calgary to see if we could understand the trends there, given that it does continue to be a place where we have higher numbers than the rest of the province. And there wasn't any one particular exposure location that was predominant in those numbers. So the exposure locations or the trends that we saw in those particular cases where we didn't know where they got it from, essentially what it appears to be, which isn't necessarily surprising, is that those who were working outside the home seem to have higher risks of exposure than those who were not working outside the home, which is a relatively logical conclusion. But unfortunately, we don't seem to see any particular pattern or trend that it is the same location where people are being exposed. So I think that the message really to drive home is that whenever any of us are out and about in the community, whether that be for work, whether that be for shopping or leisure, that we're thinking about these basic things we all need to carry forward into relaunch with us, staying home when we're sick, making sure we wash our hands frequently, not touching our face, staying 2 meters away from others. And those are the things that we need to do regularly. When we can't stay away from others by 2 meters, wearing masks to protect others from us and encouraging others to do the same would be those basic things that I think would help with some of these trends that we're seeing. Again, not any specific place, but more that when people are outside the home, they have more likelihood of being exposed.
All right, thank you all for joining us. We will provide another update on Friday afternoon.